The Race Against Time. Step-by-step diagnosis of autism. The World Health Organization (WHO) estimates that, globally, approximately 1 in every 160 children has an autism spectrum disorder. It has been observed that these disorders are more common in boys than in girls. Autism is a neurodevelopmental disorder that affects a person's communication, social interaction, and behavior. However, the reason why some children develop this disorder remains a mystery. The question arises, is autism a condition one is born with, or is it acquired due to influences from the family environment? If you're enjoying this video, give it a like and don't forget to subscribe to our channel. Your support enables us to continue creating quality content especially for you. It is wrong to think that one is born with autism. It is impossible to give credibility to this hypothesis. However, autism symptoms often start to appear in early childhood, during a child's first years of life. Although the symptoms of autistic disorder may be apparent from an early age, the disorder itself is not present at the time of a child's birth. Autism affects the way a person's brain and body function. It is not a disease and it is not contagious. It is believed that autism has a genetic and neurobiological basis, suggesting that genetic factors may play a significant role in its development. The reason why some people have autism remains unknown, and there may be multiple different causes for its origins. The exact cause of autism is still not fully understood, and ongoing research is focused on unraveling its origins. Scientists are still striving to identify these causes and to develop better ways to support individuals with autism. Autism is a disorder that presents itself in various and complex ways, making its accurate diagnosis a challenge in each case. Furthermore, the lack of a specific biological indicator for autism further complicates the diagnostic process for this disorder. Often, families around the world go through a lengthy and sometimes exhausting journey from the time they notice the first warning signs in their children to the point they receive a definitive and accurate diagnosis of autism. But, at what age can autism be diagnosed? Who diagnoses autism? Diagnosing autism is currently a matter of great importance and necessity for both families and involved specialists, as it affects a significant number of individuals. Moreover, in recent years, the incidence of autism diagnoses has considerably increased worldwide. Autism is a highly heterogeneous disorder, meaning it affects each individual differently, with a wide range of symptoms and severity levels. These symptoms can vary widely from one person to another, often making the diagnosis a complex, lengthy, and multifaceted process. Parents and caregivers often feel distressed and worried when they do not understand the reasons behind their child's behaviors, leading them to seek help from specialists and to promptly attend consultations at health institutions. During the early years of life, a child with autism may show delays in language development, not respond to their name, lose previously acquired words, or not speak at all. This leads to challenges in both verbal and nonverbal communication, and often there is a decrease in social interaction and eye contact with others. The child shows little interest in affectionate gestures and resists being hugged or kissed. They often repeat the same phrases and refer to themselves in the second or third person. They have tantrums in response to changes and prefer solitary play. Moreover, controlling their emotions is challenging, frequently expressing them through outbursts of anger or aggression. One common question among the population, particularly among parents, regarding autism spectrum disorder, is about the age at which this condition can be diagnosed. The exact age for diagnosing autism can vary significantly. Some children are diagnosed before the age of 2, while in other cases, the diagnosis may be delayed until a later stage. It is critical to emphasize that an early and accurate diagnosis of autism is essential. The sooner it is identified and intervention begins, the better the chances of providing help, support, and early therapy, which can significantly impact the child's development. Early interventions can enhance a child's communication skills, social interaction, and behavior, which in turn can significantly increase the quality of life for both the child and their family overall. What steps should you take if you suspect autism in your child? Suspecting autism in a child can be a worrying, distressing, and confusing time for parents. However, it is essential for them to take early steps, as these can make a significant difference in the child's development and quality of life. Consequently, it is important for the family to carefully observe and record the child's behavior and development from an early age. They should pay attention to signs or changes, such as lack of social interaction, communication difficulties, repetitive behaviors, or delays in speech and language development. Documenting these observations can be very helpful when discussing with a healthcare professional. Schedule an appointment with your child's pediatrician to discuss your questions and concerns. Share the observations you have recorded and any other issues you might have. The pediatrician can conduct a preliminary evaluation and, if necessary, refer you to specialists. If concerns remain after consulting with the pediatrician, consider seeking a more comprehensive evaluation from a child development specialist. These professionals are trained to conduct detailed assessments and provide accurate diagnoses of the disorder. Once an autism diagnosis is confirmed, it is crucial to immediately start planning, seeking support, and advice from specialists. This is essential for achieving positive outcomes in the child, but it is also important for the well-being of the entire family. Spend time learning about autism, its possible causes, and treatments. Also, it's important to understand your child's specific needs. Education and knowledge will enable you to better understand your child's strengths, challenges, and difficulties, and how you can best support them to become emotionally stronger. Look for support groups, whether local or online, to connect with other parents who have children with autism. Sharing complex situations, unique experiences, and valuable advice can be very helpful. It can be comforting to learn about the experiences of other families facing similar situations to yours. While it is important to focus on the immediate needs of your young child, it is also essential to plan for their long-term activities and actions. Consider aspects such as future education, transitions into adulthood, and economic independence and autonomy. These elements are crucial to ensure a good quality of life for your child in the future. Work in collaboration with healthcare professionals and educators to ensure that your child receives the necessary and appropriate services and support in school and other settings. Be aware of your rights and advocate for your child's needs and requirements. It is crucial to ensure these elements are met with certainty. Which professionals or specialists are qualified to detect autism? It is essential that the diagnosis of autism spectrum disorder be made by a multidisciplinary team. Professionals from various fields and specialties should assess and characterize the child or adult to determine if they meet the necessary criteria for an autism diagnosis. Pediatricians are often the first point of contact for parents concerned about their child's development, as they are responsible for children's health care and may be the first professionals to detect symptoms of autism in a child. They can conduct an initial assessment and, if necessary, refer the child to a child development specialist for a more detailed evaluation. Pediatric neurologists, or neuropediatricians, are doctors specialized in neurological disorders in children and can be consulted to rule out other medical conditions that may have symptoms similar to autism. Similarly, neuropsychologists, professionals specialized in studying the relationship between the brain and behavior, can play a significant role in this process. The clinical psychologist plays a vital role in the diagnosis of autism. These professionals can assess language, communication, social behavior, play, and cognitive skills, thereby providing appropriate treatments and therapies for children with this disorder. The psychiatrist also plays a significant role in the diagnosis of autism. They assess the individual's mental health, including sleep disorders, anxiety, depression, and attention deficit hyperactivity disorder (ADHD). Additionally, they rule out any underlying medical issues and assist in establishing the autism diagnosis following established diagnostic guidelines and criteria. They may also contribute to a pharmacological and support treatment plan. Speech and language therapists, or speech pathologists, are professionals trained to diagnose and treat issues related to speech, language, and communication. They can also assess a person's ability to follow instructions and respond to questions. It is important to note that the speech pathologist is typically not the professional responsible for making the autism diagnosis, but their expertise and findings in language and communication development can contribute to the diagnostic process. Other professionals who play an important role are occupational therapists. They focus on how people carry out everyday activities and how the physical and social environment affects their ability to do so. Occupational therapists can assess fine and gross motor skills, coordination, attention, perception, sensory processing, and functionality in children with this disorder. Developmental assessment specialists are professionals who use specific tools and tests to assess development in areas such as speech, communication, social interaction, and behavior. Educators and special education specialists are other professionals who may be involved in the assessment of school-age children and in planning educational supports and services. What psychometric tests or assessments can these specialists use? In order to make an accurate diagnosis of autism, it is essential for the professional to have specialized training and experience in the use of specific tests for autism diagnosis. A doctor or specialist in child development will conduct a comprehensive clinical assessment that includes a detailed analysis of the child's medical and developmental history from birth. During the consultation, observations of the child's social interaction, communication, and behavior will be conducted. Professionals may use standardized questionnaires and conduct interviews with parents and caregivers to gather information about the child's behavior and skills. Furthermore, direct observation can be employed, involving the observation of the child in different settings such as school or home, to assess their interaction with other children and adults, as well as to observe any repetitive or stereotyped behavior. Developmental tests are also conducted to assess the child's skills in areas such as speech, language, motor skills, and other cognitive abilities. One widely used international tool for detecting autism in children aged 16 to 30 months is the MCHAT questionnaire, which consists of 23 questions related to the child's behavior and is to be answered by parents. It is important to note that there is no single test to diagnose autism. Diagnosis is based on a comprehensive assessment of the individual's behavior and development. In some cases, this assessment is conducted by a multidisciplinary team of healthcare professionals, which may include psychologists, speech and language therapists, occupational therapists, and other specialists. If you suspect that your child may have autism, taking early action and seeking an evaluation is essential. Awareness and education about autism are crucial to ensure that children receive the diagnosis and care they need as early as possible. Every step you take can make a significant difference in your child's development and well-being. There are resources and professionals available to assist you and your family in navigating this journey. You're not alone on this journey. We will all be involved in this long but dynamic, novel, and wonderful path. If you enjoyed this video, please give it a like and don't forget to subscribe to our channel. Your support enables us to continue creating quality content especially for you.